Okay, guys, today we're going to be talking about audition scenarios. So this is a brief guide to help you be successful into getting into the residency of your choice. I'm Dr. Rob McNabb. I'm the Vice President of Medical Education at Freeman Health Systems in Joplin, Missouri. So getting into residency for you guys is an extremely important topic and probably one you don't know much about. So, is there a process? Have you thought about it? Are there do's and don'ts to getting the residency of your dreams? Are there pitfalls and traps for the unwary? And wouldn't it be nice if somebody just sat down with you and just reviewed some helpful tips? Maybe somebody like a program director whose job it is to hire folks into residencies. Well, today's that day, so strap in and let's talk about residency programs and the audition process. So the big picture here, guys, is that program directors know that being smart and having a high IQ and being talented, that will get you the job. But we also know that your personality and your emotional intelligence, that's the quality that allows you to keep the job, succeed in your training program, and not burn the place down with excessive drama on your way through. So we're going to talk about some different scenarios along the way. Um, Students come at the recruitment season through various pathways. We have core students, we have those who only do audition rotations, and then we have the interview only scenario. And we're going to get to all of those. So let's start with the core student. So the core student is that student who's been in your service for 24 months. They've been in your training center. You've interacted with them day in and day out. So they're a very well-known entity. And so, of course, to the program director, this is the low-risk, high-reward candidate, like the golden child. So because you've worked with them in clinical situations, you know their clinical abilities. You've gotten to see how they handle stress when you take them to those code blues, and you know them as a person. So they're about as well known as you're ever going to get in the audition world. So this makes them the best bet for a program director because they're the best understood. So when did your interview begin, I think is an important question to ask. So for course students, that interview starts day one of being a third-year medical student. How you interact with the administrative staff. Did you turn in your paperwork? Are they having to constantly nag at you to get you to do things that you need to for your medical school? Did you perform well on the rotations that you weren't interested in? Do you show ownership of your patient care? Do you participate in didactics, or are you one of those folks hiding in the back of the room staring at your cell phone? How well do you get along with your peers and the resident staff? All of these interactions go into deciding how to rank a core student. So be aware of that. You can't wait until the interview and say, now's the time to shine. So we need to talk about setting expectations. So the earlier that a program knows that you have interest in them, then the earlier they start to consider you for that position. You know, there's something mental about that. When I know you're interested in the program, it really encourages me to take you seriously, look at you as a candidate, maybe even work with you a little bit more to help you develop the skills that you need to be that most competitive candidate. So when you start a rotation, my recommendation to you is that you set the expectations at the beginning of the rotation. And what I would recommend to you is that you just flat out tell them that you want to be the best student that they've ever had. And then ask them, what would that look like? What would their expectations be for a student trying to hit that high water mark? Make those expectations your goals and then work to achieve them. And I can tell you guys that I have had students try this approach on me, and it gets your complete attention. It gives you, the student, targets to hit during the month. No need to guess how to impress your attending. Just ask them. They will tell you. So as an attending, I like working with the motivated student who's trying to challenge themselves. You end up rooting for that person. I want you guys to succeed and be the best. So if you're going to do that, then you need to know whether you're hitting the mark or not. And so for that, I think that we need to have purposeful feedback. And here's the thing, guys. Most people, by their nature, they hate to be critical. They hate to criticize. So even your attendings and your preceptors, they may not give you timely feedback when you're off track of meeting their expectations. And so it's vitally important that you ask for feedback halfway through your rotation to be sure that your preceptor thinks everything's going well and that you're meeting or exceeding their expectations. I would not wait until the end of the month to find out that there's a problem, because then there's no time to correct anything, guys. So make sure that you ask for that feedback. It shows that you're motivated, that you're engaged. It's going to really help a lot. So who was interviewing you anyway? I think that's an interesting question. You know, that coordinator who helped you set up the rotation, who had to make sure that all of your immunizations were in order. That person, I guarantee you, is part of the interview process, and they are recording and reporting directly to the program director how you interact with staff, and are you pleasant, and are you timely, are you professional. How about the nursing staff? I guarantee you that the nursing staff are evaluating how you're interacting with them, and more importantly, the patients, and that gets back to your attending staff as well. So I get a lot of input from the nursing staff. The resident staff, of course, is interviewing you. You're a potential future peer for them. They may have to tolerate your presence for 3 to 5 years. So they're very curious. Can you pull your weight? Can you do the job? Are you pleasant? Are you somebody who's going to be a team player when things go badly and they have a rough night? Or are you in it for yourself? Those residents typically have a lot more input into who gets into a residency program than you might be aware of. So always keep that in mind. And then finally, the easy target is the program director. Of course, that person, you want to impress that person, and certainly they're interviewing you, but they're getting input from far more than just their own personal experience with you as a trainee. So keep that in mind. Okay, so now let's talk about the audition rotation. So this is for the student who goes on an away rotation, and this is during your 4th year. It's a 1-month rotation, and your job is to impress that program and that faculty so they want to give you a residency position. So this is a really great opportunity. The team gets a great assessment of your skills and your personality. But one thing I want to focus you guys on is this. Remember, the program directors are looking to hire house officers. And so when you're on that audition rotation, the closer that you can function at that level of the house officer during your rotation, the better they can see you in that role. So look at what your interns are doing around you. They're writing orders. Are you? Can you? Could you write very specific order recommendations for your attending to consider? Show them that you have ownership of your patients. Know exactly what's going on with your patients. Have you talked to the subconsultants or read their notes? Do you understand the plan? Do you wait to follow up on tests until you're asked, or is it on your list of to-dos already? The more that you can function at the level of the intern, the easier I can see you in that role. And the more I see you in that role, the more I want you in that role. So come prepared for that rotation to be high functioning. If you're blending into the pack and I can't tell the difference between you and a third year medical student or a beginner fourth year, you're just not doing enough to really make something happen. So keep that in mind. Try to set the goal to function as close to the level of a house officer as you can. So you've got 1 month to impress them. So, you want to make sure that they know by the time that month is over that you're a good person, you're smart, you're dependable, you're pleasant. It's not really a time for you to be shy and then kind of warm up slowly. The team's impression of you will be formed pretty quickly, so be prepared when you get there to really show them what you're capable of and who you are. I would note, be careful with how you interact with your junior students on the team. Your trainers are evaluating you for your skills in teaching. So are you helpful and knowledgeable in your interactions with the students? Are you overbearing and are you hard on the lower level students? All these things are taken into account as they're sizing somebody up for a house officer position. And then again, remember when you're on that rotation, you're not just being evaluated in the wards. When you call to set up that rotation, the coordinator starts to form an opinion. And again, just like on the previous slides, all of these people, all are forming opinions and then shipping that to the interview committee to help them make a final decision. So this is the interview only scenario. So this scenario is more risk for the program and its faculty. And here's the thing, when you're on an interview only, they don't know you. They've never seen the quality of your work. They don't know how you hold up under pressure. You may be great. On the other hand, you might be a psychopath. Because there are a lot of unknowns, how well you rock the interview and how good you look on paper, i.e. I'm talking about your board scores, your class ranks, what your preceptor said about you on rotation, that sort of thing. These are going to really heavily influence your chances of getting that residency spot. And then you just need to know that if they're all already highly desirable core students or audition rotation students that the program really wants, you're going to be at a disadvantage behind those people. Still, there are many things that you can do in the interview to increase your success rate. So people are social animals. So if you know anybody in the program or has been through that program, that can really help a lot. You can see on the background here, I've kind of put this 7 steps to Kevin Bacon. And if you're familiar with that, everybody can link back to Kevin Bacon one way or another. And we can use that same phenomenon. So if you went to medical school with one of the residents in that program, and that person will vouch for your stellar qualities, you can get a lot of credit based on that person's recommendation, assuming that your friend is in good standing with the program, of course. So doing your homework involves finding out as much about the program as you can before you get there. Do internet searches. Talk with students and residents or faculty. Show that you're interested and motivated. It helps you to ask informed questions, and it gives the impression that you're a proactive person, and they want to see that in that audition. So I frequently recommend to students who have no connections to a program that they're going to be interviewing at to quote unquote call ahead. And what I mean is, guys, is call the program coordinator and ask to talk to a current resident or maybe even the chief resident. And you want to ask these folks a lot of good questions about the quality of the program. What makes the program outstanding? What are they working on in the program? Are the residents happy? Do they get good training? That sort of thing. And of course, the purpose for doing this is manyfold. It shows you that you're proactive and really interested in their program. And next, it gives you good details so that you can formulate secondary questions to ask during the interview. And this helps out a lot too. You don't want to be that person who has no questions about the program, because that just really shows that you're disinterested. So you want them to take you seriously. This will help you do that. And finally, and it's a little bit sneaky, but it allows you to name drop that resident that you talk to. For example, hey, when I was talking with your resident, Dr. Martin, she told me the team really loves the high quality simulation training. And then, of course, because the interviewers know Dr. Martin, you'll get a bit of a credit for even having a weak connection to her. And additionally, after that interview is over, you know that that interview team will almost certainly discuss you with Dr. Martin to get her impressions. And if she liked you, you'll get bonus credit for that as well. So keep that in mind. Even if you don't know anybody at that program, you need to, quote unquote, force a connection. That really helps out. Don't ever underestimate how networking and the fact that human beings are such social animals really impacts how they make decisions. Okay, so let's say there is something on your ERAS report that's unflattering. For example, maybe you did poorly on step 1, or maybe you had to repeat a year. So your temptation is to try to provide some kind of justification for that dent in your report. My advice, guys, is do not do that. Don't justify. Instead, you need to own that dent in your report. So, hey, I didn't study effectively. I recognized that was a problem, so I took a course and I learned how to prepare, and I came out stronger and better because of it. Or maybe I was more focused on a relationship issue, and that really brought down my progress. So I decided that I need to, and then whatever it is that you had to do. So very few people are perfect, and I think we need to remember that. So if you turn out to be one of those not perfect people, don't try and hide it. Don't justify it away. Don't blame it on some externality. Showcase it as an opportunity to show that you're resilient, that you can take ownership of a problem, that you're that person who's tough enough to have an issue and overcome it. The deal is, guys, people love an underdog, and doctors admire people that take ownership of fixing their own problems. Okay, so remember, if you're only there for an interview, that your interview team has basically no personal experience with you to help guide them. And thus, they're going to lean much more heavily on what they find in your ERAS package. We talked about that already. So it probably is a really good idea to have as good of an idea of what's in that package as possible, so that you can be prepared to respond to whatever they find there that they may turn into questions and throw at you. So you want to be able to provide details. So a lot really rests on how much they connect with you at that meeting, and you need to convince them that you have the ability to be a good intern, and that you have a good personality that they're going to enjoy interacting with. So if you're stiff and awkward, well, you're going to get pushed toward the bottom of the pile pretty quickly, guys. So if you feel like you might be one of those quote-unquote bad interviewers, you need to practice. You need to find a partner, a peer, a trainer, and practice interviewing until you develop a bit of comfort with this. Don't go into these interviews cold and be stiff and think that it won't be held against you. It will be. It will be. These people have got to like you and want you in their program. You need to make that happen. So finally, I want to talk about what I call the dinner date trap. So the program typically will take the auditioners out for a nice dinner and some sort of social event, and there will likely be a lot of residents and maybe a few or maybe no administrators there at all. And so the idea is to make you feel welcome And also, the reality is that, hey, you're still on an interview. How you handle social situations is being assessed. Are you a loner or an introvert, or are you gregarious? Are you too gregarious? Now is not a great time to get 3 to 5 beers into you and then really go wild and have a great time at these parties. So, these people, they don't know you, so they're going to put you into a few social situations to see what they can learn about you. So it's okay to have fun and you want to be social at these things, but guys, keep it under control. Okay, so now we've done our audition, we've had our interview. What's next? Well, you need to keep in contact. Keeping in contact with the program is such an important piece of your strategy. Right after you finish that interview or that rotation, you need to start sending out thank you cards to a lot of people, to the program director for sure, the faculty that you worked with, some of the residents. Make sure that you hit them all. And then mention what you liked about the program and how you could see yourself being very happy as a resident in that program. And then once you've done that, you need to follow up intermittently. So maybe like every month and a half or so, every other month, I would recommend that you guys drop an email to the program. Just express that you're still really interested in the program and you hope to be seriously considered for a position. And I would also recommend keeping in contact with the residents either by email or by texting. Many students, they don't really feel comfortable bothering the program director with a stream of emails, but then they feel a lot more comfortable keeping an ongoing dialogue open with the residents. And maybe that's because you're a little closer in peerage, something like that. And let me tell you, that works very well. The residents will report back to the interview committee that you're still interested and that you're keeping tabs on people. The more that the program understands your level of interest, the more they're likely to be interested in you as a good candidate. So keep that in mind. So in conclusion, guys, here's the big picture. As a program director, if you have the ability to be a good doctor, you're smart enough and talented enough, and you have the personality to fit in well, and we have as much familiarity with you as we can, that's what's likely to make you the most successful resident in getting that position. So I hope that this has been helpful for you guys. I hope it kind of demystifies how the program director sees the situation. Hopefully this has provided you with some helpful tips and suggestions on things that you can do proactively in all of these interview contexts. And I hope that it helps you feel more comfortable that you know what you're getting yourself into as you're going through this very important phase in your career of trying to make that leap from medical student to the residency staff. So good luck to you guys. Get out there and make something happen, and I hope that this was helpful to you.